Assalamualaikum warahmatullahi wabarakatuh. My name is ALIA IZZATI binti AZAM and I'm from group 14. I will start these presentations with the assessment of Mr. Pan. He is a 48 years old man that used to work as properties broker. He has a routine of gardening for 60 minutes daily. He was diagnosed with type 2 diabetes mellitus with hyperlipidemia and has a history of cerebrovascular accident. He also has hypoglycemic symptom and no family history of diabetes mellitus, hyperlipidemia and CVA. For the anthropometric assessment, Mr. Pan weight is 55.8 kilograms and height 157 centimeters. His body mass index is 22.9 kilogram per meter square and his adjusted weight is 56 kilogram. Next are the biochemical assessment. For his lipid profile, all readings are high except for HDL, and for his glucose profile, both FBS and HbA1c are high compared to normal value. And the last assessment is the dietary assessment. From Mr. Pan's diet history, his total calories intake was 1,856 kilocalories. 317.8 grams was from carbohydrate, 73.8 gram was protein, while 40.4 gram was fat.
Hello, my name is AMIRA MADIHAH binti RASLI and I will continue with the nutritional diagnosis. For the past statement, the first one is excessive carbohydrate intake related to food and nutrition related knowledge deficit concerning appropriate amount of carbohydrate intake as evidenced by estimated carbohydrate intake that is consistently greater than recommended amounts, which means carbohydrate was 65.9% from total energy. Next is inconsistent carbohydrate intake related to lack of meal planning as evidenced by diet history and high blood glucose, which is fasting blood glucose is 8.2 millimole per liter. For the third one is undesirable food choices related to lack of meal planning as evidenced by diet history.
Hi, my name is SYAZWINA and I will continue with the intervention. For the objective, firstly, we want to achieve and maintain normal blood glucose range from 4.4 until 6.1 millimole per liter. Second, we want to encourage a good and healthy lifestyle by emphasizing on healthy diet choices. Third, we want to avoid secondary stroke. For the energy requirement, we use two different types of formula, which are quick method and Harris-Benedict equation. Quick method show 1953 kcal and Harris-Benedict equation show 1644 kcal. The energy requirement that we choose for the patient is 1700 kcal. Next is acceptable macronutrient distribution range. For the macronutrients, we give 55% from the carbohydrate that provide 935 kcal. For protein, we choose 20% that provide 340 kcal. And lastly, for fat, we choose 25% that provide 425 kcal. Next is food exchange and distribution table. The total carbohydrate that we got is 240 gram, 81 gram for the protein and fat 45 gram. This action table gives 1715 kcal. So we move to menu for a day. For menu planning, the steak that we got is Malacca and the rest is Baba Nyonya. For breakfast, we give fried mee siam and skim milk. This contribute to 400 kcal. For morning tea, we give bun together with coffee. The total calories is 141 kcal. Next is lunch. This menu consists of rice, chicken curry kapitan, belacan ladyfingers, guava and a glass of water. This menu contribute to 334 kcal. For dinner, the menu are brown rice, stir-fried broccoli, red snapper cooked in tamarind, apple and plain water. All of this food give total calories 553 kcal. Lastly, for supper, we give 1 paku egg sandwich that contribute to 263 kcal. The total calorie for this menu is 1691 kcal. Not only the amount of carbohydrate, protein and fat, we also consider some micronutrients which are dietary fiber, vitamin C and chromium. All of these micronutrients are essential for diabetic patients. Our group is assigned to do menu for lunch and supper. Let's watch the video together with me.
Now let's move on to the modification of the menu. So for lunch, we decided to give Kapitan chicken curry or curry Kapitan ayam. So the first modification that we had done is we use breast chicken instead of other parts of chicken. According to the journal Nutrition and Metabolism, foods which are high in dietary proteins like chicken breast actually can decrease blood sugar levels, while at the same time can also increase the secretion of insulin so that the body can move blood glucose into the cells. Not only that, a full 6.1 ounce chicken breast contains 53.4 grams of protein but low in carbohydrates, which can increase blood sugar levels. Olive oil is low in saturated fats. Palm oil is about 34% saturated fats, meanwhile olive oil is less than 17%. Olive oil also has a high content of phenolic antioxidant which protects cholesterol from harmful oxidation. Next modification, we use low-fat milk instead of coconut milk. Coconut milk has a high calories and fat compared with low-fat milk. Per serving, low-fat milk has 2.5 gram fat, while coconut milk has 5 gram of fat. Next dishes for lunch is belacan lady fingers. So the modification is we use high amount of lady fingers. Lady fingers has high fiber levels, which is 3.2 gram per 100 gram of lady fingers, which help in feeling full for longer. Fiber can also slow the absorption of sugar and help improve blood sugar levels. Next modification that we had done is we use anchovies instead of belacan or shrimp paste. Anchovies is an excellent source of omega-3 fatty acids high in DHA and EPA. These are good to prevent heart disease and stroke, which are common complications for diabetics. For supper, we decided to do one paku egg sandwich. So the first modification that we had done is we use wholemeal bread instead of white bread. This is because wholemeal bread could reduce the risk of diabetic retinopathy progression. Wholemeal bread has low glycemic index compared to white bread. Diets with low glycemic index value can improve the prevention of coronary heart disease in diabetic and healthy subjects. Next is we use sesame oil. Sesame oil contains omega-3 and omega-6 fatty acids, which can help prevent several diseases such as heart disease and cancer. It can also help improve immune function. The last modification in this one paku egg sandwich is we use pumpkin. Pumpkin is a good source of low glycemic index foods. We moving on to the nutritional monitoring and evaluation. For monitoring and evaluation, the first one is to monitor dietary intake by 24-hour diet recall or diet history. Next is self-monitoring blood glucose level daily, and the last one is monitor HbA1c and blood glucose level on the next appointment. This is our beloved lecturer, which are Madam KARIMAH FAKHRIAH binti ISMAIL and Miss YING. And this is our group members. I think that's all from us. Thank you so much.